as I said in my presentations, I showed that there are several opportunities in terms of monitoring treatment response in progressive MS. We have, on one hand, the traditional MRI measures that we have been using for years. They are okay in the sense that they provide some treatment response, but the feeling is that using the traditional methods, we actually are getting a response related to the residual inflammation that there is in these patients. Instead, what we want to do to have a real impact on the progression of MS is to try to find something which is has an impact on the neurodegeneration, potentially on the neuroprotection, but also on on the subtle inflammation that there is in the brain of these patients. So what I was proposing in my talk is to add to the traditional measurement of MRI some new measurements like the slowly expanding lesions that I mentioned in my talk, which is it's a very good measure of the smoldering inflammation. And on the other hand, to be closer to the neurodegeneration and potentially the neuroprotection by assessing brain atrophy, but particularly gray matter atrophy, which has seems to have an impact on the on progressive MS, and so slowing down the gray matter atrophy by a given treatment can be a good measure of something happening in really slowing down the progression, the real progression of neurodegeneration, so having a neuroprotective impact. Of course, these are measures which could be used and should be used in the clinical trials. Let's say at a group level, not at the at the individual level right now, because we need more information in how this could be used and what the impact this measure can have on the individual patient. So right now we are in the position that these are actually good measure for the clinical trials, for studies at the group level, and so trying to have confirmation from this. See what kind of variability we have at the individual level, and then proceed with that. Unfortunately, everything in medicine sometimes is so slow. But when we want to have evidence of the impact of this sort of measures, this is the only way to go.